Hi, my name is Stephanie, and I'm a respiratory therapist with the Pulmonary Rehab Program. Today we're going to be talking about some breathing and coughing exercises. It's just as important to work on your breathing muscles as it is the rest of the muscles of your body. So your arms and legs can get stronger with exercise, and so can the muscles of breathing, your diaphragm and your stomach muscles. So that's what we're going to talk about today. If you want to follow along, you can. So it's important to do some exercise every day. This, goes with the exercises for our legs and arms as well as these breathing exercises. When you have COPD, your diaphragm, which is the muscle that sits underneath your ribs inside your body, it tends to flatten out. And then it's not as able to work as well when you're breathing, just because it gets flattened out. It can't contract as far. So these exercises that we're going to go over today are going to help you to strengthen the diaphragm so that it can work a little bit harder. Even if you don't have COPD, it's really good to work on these breathing exercises every day. They will strengthen your breathing, your diaphragm muscles, but they also can reduce your shortness of breath with activity. Okay, so the two exercises we're going to be going over today are pursed lip breathing and diaphragmatic breathing. It's important to do these exercises slowly. Okay, we're not straining. We're not going as hard as we can, as deep as we can. If you've ever done a pulmonary function test, nothing like that. We don't want to do that. In pulmonary rehab, we do talk about pursed lip breathing quite a lot because this is the easiest technique to learn that will help reduce shortness of breath with activity. Everybody who comes to pulmonary rehab has that symptom, shortness of breath with activity, and this is the number one way to help with that. So the way you do pursed lip breathing, you want to breathe in through your nose, and I'm going to go over it before I demonstrate it. The reason we breathe in through your nose is because your nose helps to heat, humidify, and filter the air you're breathing so that it's more comfortable for your lungs, okay? And then after you breathe in, just comfortably, not great big, just to your comfort level, you want to purse your lips. Now, what does that mean? That means like you want to whistle or like you're about to blow out the candles on a cake. So you breathe in through your nose, purse your lips, and then you're going to breathe out slowly. A lot of people say smell the roses and blow out the candles just to help you remember what to do. And if you want to use that as your reminder of how to do this technique, that's okay. So smell the roses and blow out the candle. Now, some people get caught up on counting, and it's okay to do that if you want. If you like to count the inhale for 2 seconds and then the exhale, the breathing out for 4 to 6 seconds, that's fine if you want to kind of count in your head. But if you're pursing your lips, your exhale should naturally take longer than your inhale. Okay, so I'm going to demonstrate that one more time. So you see, I'm not taking a great big breath, and I'm not exhaling until I'm completely empty, okay? So do not strain with this exercise. But pursed lip breathing, again, as the document shows, it's a simple technique that can have a positive effect on your breathing. It can help with exercise, it reduces stress, and it increases oxygen to your body. It reduces stress because it gives you something else to think about. Sometimes we get into this vicious cycle of I'm short of breath and I don't know how to catch my breath, and you just start to pant, right? Well, if you have something to focus on, this can help with reducing the anxiety with shortness of breath, okay? So we're going to move to the next exercise, and that's called diaphragmatic breathing or belly breathing. So I'm going to describe this now. The reason for this breathing exercise is to directly strengthen your diaphragm. Okay, it's inside your body. You can't put weights on it. You can't, do exercises on your diaphragm directly except for breathing exercises. So the way you want to do that is you want to sit comfortably, have a good relaxed posture. So don't be tense when you're doing this exercise. You definitely want to relax your shoulders. And a second method is to lie down, and I'll talk about both of those. So a good way to do it is to put a hand on your belly. When you breathe in, we're going to keep doing pursed lip breathing, by the way. When you breathe in through your nose, you want to push out with your belly. Okay, so it's going to feel opposite of what most people do. Most people suck in when they're breathing, but this is an exercise we want to actually push the belly out. And what's happening is the diaphragm is pushing the belly out, pushing down, and that's what's making that diaphragm do the work. Okay, so we breathe in, and you should feel the belly go out, and that's why your hand is there. You should kind of focus and feel the hand come out. Now, when it's time to breathe out, you want to do pursed lip breathing, and then your belly will come in. Okay, so I've got my hand on my belly, in, belly goes out, breathe out, belly goes in. Okay, now there is, it does say here to repeat and then, rest after 3 to 4 breaths. When this is new for you, you may get tired kind of, not quickly, but you may feel a little warmth in your belly area, and you just want to rest and do this, slowly. Any of you have ever been in a choir or did anything like that with singing? You probably learned how to belly breathe without even knowing it. And that's one way that you would have already known how to do diaphragmatic breathing, even if you didn't realize it. So this image here shows you when you breathe in, belly should go out, and when you breathe out, belly should go in. Okay, so hopefully that is a good reference there. The other image here shows you can do this laying down. Now, for some people, it's more comfortable. It's more, hang on, I'm going to turn the light on. Okay, so doing this diaphragmatic breathing, it's very important to make sure that you're comfortable, that you don't have any tight-fitting clothing on. So a lot of people like to do this before they get up in the morning out of bed, or when you first go to bed at night. So there is a version that I've shown here that shows how you would do that laying down. So you're going to already have a pillow under your head in bed, but it's nice to have one under your knees just so you can relax. And the reason you want your knees bent is to just take some pressure off your lower back. Okay, so you're going to do the same thing. You can put a hand on your belly just so you can feel it, and it should be easier to notice the rise in the belly when you breathe in if you're laying flat. And then back out through pursed lips. Good. So these exercises are important to practice, 2 to 3 times a day if you're doing the diaphragm breathing morning and night before you get in, and when you go to bed, then you're fine. It takes practice. Both of these take a lot of practice, but the more you practice, especially at rest, the more likely it is that your body will automatically start using these techniques when you are short of breath. So that's the important thing, is to practice doing these. Okay. Now we're going to go into controlled coughing. So controlled coughing is a technique that will help you get mucus moving out of your lungs. And a lot of people stop me there and they say, well, I don't really have any mucus. I don't cough up anything. Well, everybody has mucus in their lungs, and your lungs create that mucus to help trap smoke and pollution and germs, dust, things like that. So everybody has mucus. Sometimes your body makes too much mucus, and you may have a disease called chronic bronchitis. But even if you don't, controlled coughing is a good technique to use, especially if your diaphragm is weak. Speaking of diaphragms again, so this allows you to avoid having coughing fits if you have a lot of mucus, okay? So it's important to do this again when you're rested and not when you're already having coughing spells, okay? So first thing in the morning before you really get started, or after your breathing treatment in the morning, that's a good time to practice controlled cough. Okay. So coughing is one of nature's ways of cleaning up the lungs, as I mentioned. Now, it's important to get rid of extra mucus so that it doesn't build up and it can cause infections. So you really want to be careful about that. Now, some people take a cough medicine if they're having a lot of cough, but just be careful about that and make sure to talk to your doctor about that first. Cough medicines can inhibit your cough, and since we just talked about coughing being nature's way of cleaning the lungs, we don't want to inhibit that cough too much, okay? Now, I mentioned that it's easier to cough up mucus that's thin, okay? So how do you do that? How do you thin mucus? Well, you need to be hydrated. Okay, so the water that you take in, that you drink every day, does affect the mucus in your lungs. It doesn't feel like it does, but because the mucus is in your lung and you're drinking water and it goes to your stomach. But that water hydrates the entire body, okay? So you would see if you're not well hydrated now and you do develop, drink enough water to be hydrated, your mucus should thin out, okay? So thick, sticky mucus can cause shortness of breath, wheezing, hacking coughs, and infection. And the goal is to drink lots of water or other caffeine-free fluids every day. For most people, it's 8 to 16 8-ounce cups per day, okay? So how do I know 8 or 16? How many should I drink? A good rule of thumb is to take your weight in pounds. So let's say you're 140 pounds. So you're going to divide that in half. So that's 70. So you need to be trying to drink 70 ounces of water per day. Okay. And if you're drinking an 8-ounce cup, which really is not a lot, if you measure it out, if you have a measuring cup at home, an 8-ounce cup, so that would be less than 10 of those cups per day. So the best thing to do is to take your favorite cup at home or water bottles and see how much is actually in there. A lot of water bottles are 16 ounces, so there's 2 cups. You know how many you need to drink of those per day. Now, if you're not really sure if you're well hydrated, one way to do that is just to check the color of your urine. The darker it is, the less hydrated you are. You should be looking for a pale yellow color. So if you notice that your urine is dark, what you can do is add increments of water each day until it becomes a little more pale. First thing in the morning, it's always going to be a little darker just because you've not gone to the bathroom overnight. Be really careful though if you have kidney failure or congestive heart failure, or your doctor has for other reasons told you to limit your water. You really should pay attention to that and go by their recommendations. So always talk to your doctor about how much water you should be drinking if you are concerned about it or if you have any of those conditions I mentioned. Okay. So let's move to the next thing. Now, when you do cough, I want you to cough into a tissue, especially if you bring mucus up and out. Excuse me, there's mucus. So spit it into a tissue, and I know it sounds gross, but please check the color of your mucus. If it's yellow or green, it could be a sign that you're having an infection, and you want to call your doctor right away if that color is different from your normal, and they may prescribe an antibiotic. That could be a sign of infection. If they do order an antibiotic, as always, make sure that you take the full prescription so that you can completely get rid of the infection, even if you feel better before you're done. It's important to always know kind of what your normal mucus color is. You don't have to share it with people. You don't have to show it to them. But every day that you have something coughed up, make sure to check and keep an eye on that. Okay. And then always wash your hands after you throw away your tissues when you cough up things. You know, it's something that's easy to do when you do have a cough and you're out in public. If you're not wearing a mask, coughing into your elbow is a good idea. We don't usually do a lot with our elbows, so it's a safer place. Better than nothing, better than coughing out into the air. So now I'm going to talk about these controlled coughing techniques. There's two different techniques I'm going to kind of go over today. Just like the pursed lip breathing and the diaphragmatic breathing, you want to make sure that you're well rested. Okay, in other words, you're not already worn out when you practice these exercises. Just like you wouldn't go and exercise, you wouldn't do a lot of weights or leg exercises if you were already really tired. It's not a good idea for your body, okay? So this first controlled coughing technique, you want to sit in a chair with your shoulders relaxed and both feet on the floor. You're going to put one arm or hand on your stomach, and then we're going to have our other hand up to cover our cough. We just talked about, preventing infection and preventing spreading of infection. You're going to breathe in through your nose, and then as you lean forward, you're going to exhale and push the arm into the stomach, and that's going to help you exhale more fully. While you're doing that, we're going to cough 2 or 3 times, okay? So I'm going to demonstrate that. So my arm is at my belly. I'm going to lean forward and breathe and okay, and then I'm going to breathe back in through my nose as I sit up. Good. Now, it's important to not force this cough, okay? No matter what it sounded like on the video, I wasn't really forcing that cough. It wasn't a hard cough. It's going to hurt your throat if you do this too much with a really hard cough. It should just be a normal cough, okay? Now you want to practice that. You want to repeat that maybe once or twice. And if you feel a little bit of mucus, go ahead and do it again until you get some mucus up. And if you want to have a tissue in your hand, if you're likely to cough up mucus, you can go ahead and have a tissue in your hand and you can catch that so you can check it for infection. Okay. So that is a controlled cough. Now let's say you're already having issues with your throat being sore. For whatever reason, if it's because you've had a lot of cough or your throat is sore from something else. Another technique is called the huff cough, okay? So this is a different, everything is exactly the same as the controlled cough, but instead of making that hard cough sound, we're going to make a ha sound, okay, or huh sound, like the huff, okay? So I'm going to do the same thing. I'm going to have my hand on my belly, in through my nose. I'm going to lean forward, exhale, and squeeze my belly and make that huh sound as I cover my mouth, okay? Okay. And what's happening here is we're still squeezing, we're still forcing the air out, and by making the sound, we're still making the movement as a cough, but we're not closing our glottis to make that hard sound, okay? So what that does is that helps to save the glottis from getting too sore, okay? So all of the techniques that I talked about today are important to practice regularly. So even if you do not have a very productive cough, both of these coughing techniques are great to practice. If you do tend to have quite a bit of mucus, I definitely recommend doing your breathing treatment in the morning and then practice this controlled cough if you haven't already been coughing from your breathing treatment. Once again, we're going to go back over the pursed lip breathing and diaphragm breathing. These are really important to practice every single day, pursed lip and diaphragm breathing. And remember that the more you do of these exercises, the stronger your diaphragm is going to be. It's just like any other muscle. It takes time to build up strength. You don't go and lift 20-pound dumbbells and expect to, be able to carry all the groceries in without struggling. It takes a lot of practice, and it takes slow practice. So just get into the habit, set an alarm, whatever you need to do to remind yourself to practice these exercises every single day. When you're in pulmonary rehab, we'll be reminding you of the pursed lip breathing, and we'll be doing the diaphragm breathing exercises with our relaxation. We don't necessarily practice the controlled cough in pulmonary rehab because there's a risk of contaminating other people with that. But we want you to exercise and have that controlled cough happening at home, okay? If you have any questions about anything you've seen here, please feel free to ask your pulmonary rehab coordinator, and I hope you have a great day.